It is a very nice initiative from International Ambedkar Doctors Federation, and for our all Ambedkarite people to get to know about the disease. There are quite myths and misinformation in the society. So we all, as a doctors, we have dual responsibility, not only to make everybody aware about the current disease and aware about this disease in respect to not only to the general society, but also towards our particular community, that is the lower caste and lower class. So mine will be a pictorial and statistical presentation, and no bullet points, simple presentation. So the topic is social impact of COVID-19. So the biological part has been dealt with by Dr. Shankar, and the epidemiological part by Dr. Govinandan, and pathology by our Honorable President Dr. Rajendra Prasad. I'm going to talk about the influence of this pandemic on general public, and which part of the civilization is going to get affected and how it's going to affect it. So as we have already entered the stage 2 and stage 3 of this COVID epidemic in India, so I'm going to discuss on what will be the life with corona and how do people cope up with coronavirus. Does it divide us or unite us? The pre-existing challenges, the prevalent practices, the general well-being of the people, and how social cohesion is going to help our society. The medical etiology part has been dealt with by Dr. Shankar. I am going to focus on social etiology part. So this COVID-19 is a virus or a disease or a pandemic which came with the rich and is liable to be killing the poor people. So elite class were original globetrotters, and the high class people, they are often engaged in layer tricks. But the middle class people, they are new to international traveling because of the freebies they attain by attaining professional targets, whether being doctors or even hardware people, cement people. They are exposed to international travel nowadays once they attain professional target. So elite class, the high class, and the middle class, they gradually they converted this epidemic knowingly or unknowingly to an pandemic. So so ultimately this pandemic is transmitted by the rich, and the poor are going to be affected. So particularly focusing on the COVID-19 catastrophe as far as Indian perspective is concerned. As our country is concerned, there were pre-corona disparities. There were inequality in income, and the education disparities between the rich and the poor, as well as the urban and the rural class. There are gender disparities, large gender gap between male and female, and the caste and class gap has been in our country since centuries. So all these things make India unique, and it is a breeding ground for a Holocaust. So once we enter the stage 3 or 4, I expect that India is going to fare from bad to worse. First of all, we talk about the economic imbalance. So if India's land is to be divided like India's wealth, you can see the pictorial representation. Almost half of the India's geographical map goes to only 1% of the population, and the richest 10% of population contributes to about 3/4 of the country's wealth, and the poorest 60% of the population has only 5% of the wealth of the country. So you can see how big is the economic disparity in India. Baba Sahib dreamt of economic democracy, and in India, though we are focusing on political democracy for last 60 to 70 years, nobody focused on economic democracy, and these are the results. You can see the results of ignoring the economic democracy. This was a project by Johnny Miller. This was a drone project, and this is a bird's eye view of slum in Mumbai. The project is known as unequal seeing. You can see neighboring high-rise buildings as well as the slums. So as far as COVID-19 is concerned, this virus is going to transmitted from high-rise building to the people who are living in lanes and shanties, and they are going to be the people who are going to bear the brunt of economic inequality. The second is inequality in education. So 66% of the people, 66% of children of our country, they go into government schools. So the COVID-19 is also going to affect these school-going children as both in curriculum as well as nutrition value. The private schools, they are taking online classes, and they are updating their children with academics, while the students of the public school or the poor students, they are going to lag behind in their academics, and there will be ultimate education disparity in this academic year. Moreover, the public school students, they are more dependent on the midday meals for their nutrition. So there is also going to be a nutritional deficit between the rich and the poor, and the urban and the rural people, and this nutritional deficit will lead to this thing. This slide shows the global hunger index in 2019. So India was at 83rd rank in 2000, and now it has gradually slipped to 102 ranks in 219. Only 15 nations are behind India in this global hunger index in 2019. Our poor neighbors like Nepal, Sri Lanka, Bangladesh, and Pakistan, they also fare very well in global hunger index last year as respect to our country. So as this cartoon suggests, that the poor are not only going to be affected by the corona. Before as Dr. Mohanand already said, that before the coronavirus kills, the starvation is also going to affect the poor. Then the third thing is gender gap. So the global gender gap index ranking of India into 2020 is 112. So India fared at 112th rank out of 153 nations in the gender gap. Even our neighboring countries like Nepal, Sri Lanka, and strife-torn Rwanda fared very well in this gender gap. We can well imagine by the fact that only 14% of the women are in our national parliament, and only 4% judges are in the Supreme Court. 47% women agreed that the husband partner is justified in beating his wife or partner, and almost 70% females above the age of 15, they feel unsafe walking alone at night at area where she lives. So this is the insecurity that our fairer sexes feels in our country. So when we enter, when this catastrophe, this pandemic enters the third or fourth stage, you can judge, you can fear that what is going to happen to our females. They are going to bear the brunt of this gender equality, which we are unable to fulfill since our independence. Then is the difference between the caste and the class. There was a study conducted by JNU, and the study topic was wealth ownership and inequality in India, a socio-religious analysis. Study was conducted in 1 lakh household. The study showed that almost 22% of the higher caste Hindus, they amassed about 41% of country's wealth, while the ST population had only 3.57%, and SC population had only 8% of the country's wealth. So you can well imagine that the caste and class disparities, which are prevalent in our country since centuries, they are still there. This study concluded that the caste still continues to determine the level of education, nature of profession, and resultant income and assets that an individual will own in this country. So ultimately, all these disparities will lead to the economic breakdown, and you can see the economic effect of the COVID-19. It is going to be there is going to be largest global recession in the history of the world. And India's GDP, which is currently around 6% for 2019, it is projected to be as low as 0.8%. As one third of the global population is going in lockdown. So unemployment rate, pre-corona unemployment rate was almost 45 years high in 2019 at 6.1%, and lockdown has produced almost 1/4 of the India's population to unemployment. So there will be going a severe livelihood crisis. Dr. Babasaheb Bhimrao Ambedkar had dreamt of an India where the informal sector, where the labor class are going to organize themselves. But unfortunately, neither the government nor the trade unions, they organize the labor class, resulting in the fact that as we stare at 2020, the informal sectors consist of 80% of the India's population. These informal workers are self-employed 50%, daily wages 20%, and salaried or contractual 30%. So after the lockdown or after the curfew, the self-employed people will left with no capital to reinvest and continue their livelihood. The daily wages will be deeper in poverty, and the contractual staff will have job insecurity. So International Labour Organization already predicted that 40 crore Indian workers are going to be affected by this pandemic. So what the government is doing is that they are known to accomplish their agenda. So there is partition relief package. As a required estimate of about rupees 10 lakh crores, the government has announced only 1.70 lakh crores for 1.4 billion population. This is in contrast to corporate loan waiver, that is 1.76 lakh crores. That is more money was given back. That is corporate loan of only 416 defaulters, each owing 100 crore of more were waived off. So only 416 corporate groups were given for 1.676 lakh crore, and whole of the country is given 1.70 lakh crores for corona package. You can see the disparity. So this government is for the rich and for the corporate. So because of this partition relief package, you can see irrespective the successive governments after independence have been pursuing this policy. So you can see the difference between these two pictures. There is a huge amount of this difference. It's the same, the citizens of the same country, one of them is living in a 1 billion crore house with 6 floors dedicated to cars only. And you can see on the other package, on the other picture, that there are migrant laborers who are unable to go to their places after the lockdown, and they are sitting behind the Yamuna bridge, and overcrowding is there. They can spread one person of this can spread up to 500 workers the corona disease. So the health infrastructure of India is concerned, we can compare it with US, because US is currently facing the brunt. In US, there are almost 50,000 deaths, and almost 20 lakh people have been affected by this disease. But in spite of the fact, there are almost 100 beds, 100 nurses for 10,000 people, 27 doctors, and 31 hospitals for 10,000 people. If we see, in contrast to India, there are only 6 doctors per 10,000 people in India. And if a developed country like India can have 50,000 deaths during stage 3 and 4, India is going to be faring far worse, because it has not entered stage 3 and 4, and on top of it, it has only 6 doctors and 12 hospitals and 30 nurses per 10,000 people. So India has been there have been misplaced priorities. The health has never been any government's priorities. The health budget of India was around about less than 2%, while the US was 8%, and even Nepal contributes 6% of the GDP to its health. The defense budget of India has always been 5 times that of the health budget. So these misplaced priorities have placed the India's life expectancy into 125 rank, and health expenditure per capita in 140 rank. So we are already placed at 125 rank in health life expectancy. So how can we expect to deal with this? How can we expect the government or our public system to deal with this catastrophe? So these are the normal findings, and the country with the most critical care beds per capita, the US has 35 beds for 1 lakh inhabitants, while India has 2.3 beds only for 1 lakh inhabitants. So US has 15 times more critical beds than India, in spite of the fact that they are already facing more than 50,000 deaths. So ultimately, when we enter the stage 4, India would be needing more and more of ventilators. So you can see the data that as US has almost 2 lakh ventilators and 10 lakh ventilators are in demand according to their population, while India there are only 50,000 ventilators in spite of 40 lakh ventilators which are going to be demand. So this gap of ventilators, that is out of 100 people who are going to affect by COVID-19, 99 people are going to not to go to avail ventilator facility, and you can well judge that who will be the one out of 100 who will get the ventilator, and who are 99 out of the 100 who are going to be left out. These are the people who are going to be of lower class, poor people, and they are going to face the music.
Exactly.
So how the government has tackled this deficiency? They have tackled this with misinformation and theatrics. So our honorable PM has been on TV five times for this pandemic, but he has never ever explained any concrete plan to deal with pandemic. On the other way, they are promoting mythology like Ramayana.
Ramayana, Mahabharata shows.
once the people, the civilization is liable to perish. So health care in India is poor, it is fragmented, it is skewed in urban class, and is often of low quality. So low income workers, they are also insecure, uninsured and underinsured. So the socially, economically, and sexually disadvantaged person will be left impatient. And the caste and class bias is bound to hamper uniform distribution of the scarce resources once we enter the stage 3 or 4. You can see this picture that this is a well-groomed male with a mask of 2,000 rupees. This picture represents the bias. That only those people who are going to be rich, who are preferably male and of upper caste and society, they are going to get the government benefits. Others are going to are liable to perish. So another thing the government has done is that shift the blame to a particular community. So according to the greatest enemy we feel is not the coronavirus itself, it is the stigma that turns against each other. So the government has conveniently and mischievously shifted the stigma to a particular community, and the second, this is in stage 2. In stage 3 and 4, they will be smart enough to shift the blame to the lower class and lower caste, because they will be shifting the blame by saying that they are less hygienic, they are less nutritious. So they are the main proponents of the virus. So the Cordon Sanitaire was a term, initially was a medical term to describe the swine, that Spanish flu. But the medical term Cordon Sanitaire is also mischievously been transferred to social Cordon Sanitaire. So ultimately there is territorial segregation, there is caste segregation, there is segregation of rich and poor, there is segregation of upper caste and lower caste, as well as the migrant laborers as the original inhabitants. So everything is being mischievously that we need to understand as early as possible. And another misnomer is social distancing. It is my personal view that instead of using social distancing, we should use physical distancing. Physical distancing is rather a better term. We need to have social solidarity rather than physical distancing, rather than social distancing, and we should practice physical distancing. So there are decades in which nothing happens. There are weeks in which decades happen. That is Lenin. So normally our democracy, it propagates liberty, equality, and fraternity. But we are entering into special situation where our liberty will be curtailed. We are not free to go to any place. We are not free to do anything. Our equality is also mischievously being curtailed. We are not going to be treated like equal. Those who are lower caste and lower class, they will not get the social benefits. So we need to get aware of this thing, and the fraternity is also in danger. So the management, according to the United States United Nations COVID-19 Global Humanitarian Response Plan, we must come to the aid of million and million at least able to protect themselves. So the least we can do is that government resources, we will be short of ventilators, we will be short of doctors, we will be cordoned off, we will be blamed for everything. So only way out for our people is to protect themselves. So the treatment that which United Nations recommended is solidarity, which we lack, and political will. We all know that that our government is smartly propagating their hidden agenda even in this pandemic, and the government need to have innovative policy which they don't have any, and uphold the right to health. We never had the right to health since our independence, and access to information, care, and medical services. So India is a place where there is a lot of misinformation from WhatsApp University rather than the crude statistics. So if not properly addressed, there will be exclusion of the lower caste and class. Their inequality will rise, and ultimately leading to discrimination and unemployment. So we can stop Corona. I request all the members of IADF and all the viewers, all the people to make our people aware that only way out of this catastrophe or this COVID-19 pandemic for our people, for the downtrodden, is to protect themselves, not to adhere to misinformation, and not to get depend on government on any facilities. We need to protect each other. We need to show social solidarity, not even in amongst each other, but also amongst those who are those religions who are particularly targeted. Thank you so much. Thank you, Dr. Partisan. Yes, thank you, everybody.